Yeah, right. So it's not really a holiday.
Yeah, it's quite a
And everybody has to take the holiday at the same time. Yeah.
yeah.
It must be very busy.
Yes, in a way, yeah. I think maybe we can start at 4 o'clock, and then other people can join continuously.
Sounds good. We've got several in here, so that's great.
Yes.
Go for it,
yes.
Annie.
Yeah. OK， 大家好，欢迎来到2021年的兽医进阶系列培训网课。行动亚洲和兽医关爱国界非常高兴能够为您带来我们的系列培训网课通过兽医的教育提升动物的福利。那今天的网课是我们今年的第7场的网课我们也是世界小动物兽医协会的教育伙伴。那我是今天的主持人，还有翻译之一，我是 Annie。今天和我们一起连线的呢，还有行动亚洲这个项目主管董 Pcr， 还有来自兽医关怀无国界的外科专家Dr. Rebecca White. Dr. Rebecca, if you would like to say a few words, that would be wonderful. Thank you.
Yeah, sure. So thanks, Annie, again, and our other translators, Emma and Martin, for your help today.
感谢大家能够今天参与，然后也感谢所有来连线的医生，包括我们一起协助的 Martin，还有翻译的 Emma。
And thank you for everybody who's joining, and I'm sure we'll see more as we go along. It's always really nice to see all the familiar names and faces.
那也感谢那个不断的来上线的这些兽医师们，很高兴能够看到很多这些熟悉的面孔。
And I know that lots of you will already have met Kate last time she did a webinar for us, but because we have got lots of new trainers since then, I will introduce her again.
那相信可能有的兽医师已经见过 Kate 医生他之前也跟我们上过一次网课，但是因为我们有一些新的培训师来加入，所以呢，就是今天还是会占用大家的时间来介绍一下 Kate 医生。
So Dr. Kate Arnold is a New Zealander, but did graduate from Melbourne University with her undergraduate vet degree.
那凯特医生他是新西兰人，但是他是在澳大利亚的这个学校来读的兽医的学位。
That was in 2006. And after that, she came home and spent a little bit of time in mixed practice. A little bit of time before deciding that she liked small animals best, and eventually narrowing it down to just cats.
那凯特医生他06年毕业拿到他的兽医学位，然后呢回到新西兰以后，他稍微的在这个就是这种常规的这种全科的动物医院工作了很短的一段时间，然后之后他就决定他非常喜欢的是这些小动物医学，然后之后呢他就更确定了自己喜欢的是这个猫咪。
And Kate became a member of the Australian New Zealand College of Veterinary Scientists in Feline Medicine in 2014. And since then has been lucky enough to work in purely feline practice for the last 5 years. So lots of huge cat training and experience that she can bring to share with us today.
那凯特医生他是2014年获得澳大利亚和新西兰兽医科学学院猫科医学的这个成员的认证资格。那在这个之后呢，他在过去5年的时间是专门只是看猫咪。然后在所有的这些时间里面，他也有很多这些培训的经验，然后很多这个分享跟兽医师来进行分享的这样的经验，所以他对我们来说也是一个非常宝贵的一个资源。
And there's obviously plenty of keen feline medicine vets in our team, because boy did we get a lot of amazing questions for Kate, but given the fact that we don't have I don't know, maybe 12 hours to talk, we have had to narrow it down a little bit to the subjects that we think are the most useful for you. So I'll hand over to Kate.
那就是我们的团队里面，包括我们自己培训师，有非常多的医生是非常非常喜欢猫咪的。然后，当然上线的这些其他的兽医师，当然也对猫咪的医学有非常独特的兴趣。那我们在这个问答课之前收集了很多的这些问题，但是呢，因为这个时间有限，不可能把大家所有的问题全部的都涉及到，所以呢，我们今天会就是挑选这个最有代表性对大家最有帮助的这样的一些问题来进行解答。
Thank you, Annie, and thank you, Beck, for the welcome, and thank you to everyone for the questions. They covered a wide range of topics, and it's been good for me too to refresh my memory about some of these things.
好，感谢贝克的介绍还有感谢刚才其他医生。那我们就是有这样的一个时间能够分享这个猫科医学，很高兴。
So I'll start with the first question, which was regarding options and recommendations for respiratory mycoplasma treatment in cats. Just to recap, mycoplasmas are anaerobic bacteria that do not have a cell wall.
好，所以我们首先就从猫的支原体感染这个问题来开始。然后首先是小小的一个复习，支原体是一种厌氧的这样一个没有细胞壁的这样一种革兰氏阴性的细菌。
And there are two types of mycoplasmas. There's hemotropic ones that are found in the bloodstream and non-hemotropic that are found on the respiratory system.
所以有两种大类的这样的支原体，有一种是嗜血性的，所以它们会在这个血液里面发现，然后另一种是非嗜血性的，这样的支原体呢是在呼吸系统中可以发现。
And the first thing to work out before you treat a cat for mycoplasma is to make sure that mycoplasma is causing a problem, because most cats will have mycoplasma in their upper respiratory tract as a normal organism.
所以在考虑如何来治疗支原体感染的时候，我们首先要确定的一点是，在这个猫病患身上发现的支原体，实际上面确实是导致病的原因，因为很多的健康的猫的上呼吸道也会带支原体。
So if you're looking to try and diagnose mycoplasma, the only really accurate way to do that is to take samples from the lower airways and look for it there. It is not meant to be in the lower airways at all. Whereas if you find it in your upper airways, you cannot tell if it is actually causing disease or not.
所以如何来确诊这个猫真的是有支原体感染呢？是需要从下呼吸道来采样，然后发现支原体才可以确诊。因为如果只是从上呼吸道收集采到支原体的话，没有办法确认这是不是真正导致病情的一个病源。
So when it's in the lower respiratory tract as well, and when we talk about sampling, we're talking about taking a lavage sample, then you also have to work out whether it's actually causing the disease that you have or whether it's the result of the disease that you're looking at.
所以我们如果是从下呼吸道，然后通过这样的一个灌洗的方法，然后采到了支原体之后，还要确定的一点是，究竟是支原体导致的病情，还是因为这个猫有呼吸系统的症状，然后才会发现了这样一个次发性的支原体感染。
So often, whether it's upper airway or lower airway, you have another disease involved. In the upper airway, that could be a virus, like herpes virus. And in the lower airway, it can be viral infection, but also asthma.
如果是猫的上呼吸道，有上呼吸道症状的话，很有可能是病毒造成的。然后如果是下呼吸道的话，除了病毒造成之外，还有可能是这个 asthma any 哮喘。
Yep. So And when we diagnose it too, you have to either diagnose it with a special culture that needs to be started within 24 hours, or you're performing PCR testing on those samples from the lower airways.
所以我们在采样想要看是否有支原体的时候，这个从下呼吸道采集的样本，如果是用来就是培养这个细菌的话，需要在采样之后的24小时之内，就要去化验。然后如果是或者是也可以用 PCR 来化验。
So to get back to the question, antibiotics are the main treatment for Mycoplasma, and I will talk about which ones, but you must be very careful that Mycoplasma is the only thing you need to treat and that you don't have other infections or diseases, both in the upper and lower airways.
所以回到问题，因为问题是问如何来治疗支原体感染，所以如果我们确定是支原体造成的话，那抗生素是最主要的这个治疗方案。但是我们需要确定，首先，这个猫只是因为支原体造成的这个病，而没有说上呼吸道或者下呼吸道的其他的病症。
And a really good example of this is cats with asthma, because often they will present as a coughing cat, and you may find Mycoplasma, but unless you also diagnose the asthma, you're not going to get their disease under control.
一个很好的例子就是有一些猫，它们其实是有哮喘的，但是如果你从这个下呼吸道，然后采集到了支原体，如果只治疗支原体的话，这些猫如果哮喘没有得到治疗，它这个就是呼吸的疾病也是没有办法完全治好的。
And on the other hand, if you think you have a cat with asthma and it looks like typical coughing asthma with a bronchial pattern on X-ray, and you're very convinced it has asthma, but it does not respond well to your treatment, it may be because you have Mycoplasma there.
然后类似的，如果你诊断了这只猫它有哮喘，然后在那个 X 光片上面也是很典型那种哮喘的这个肺的样子，但是治疗它的哮喘之后没有特别好的这个效果，那还要考虑它是不是有就是支原体感染。
So getting back to treating the Mycoplasma, unfortunately, because it is very difficult to grow Mycoplasma in a laboratory, we have no data on sensitivity, or very minimal data on sensitivity of antibiotics.
因为支原体是非常非常难，在这个就是实验室里面给它培养出来的，所以我们对于它的这个抗药性或者耐药性，的这方面的数据其实是非常非常少的。
So our treatment is always based on our knowledge of what works in the laboratory, and we have to just choose the best ones based on that. And those 3 antibiotics that usually work are the tetracyclines, the macrolides, and the fluoroquinolones.
所以绝大部分情况之下，我们都没有办法通过就是实验室的这个耐药性的这样的一个化验来决定要用什么药，一般都是直接的就是这样类似凭经验来用药。然后有3大类的抗生素是对支原体是比较管用的，这3大类是4环素，然后聚环素，还有氟喹诺酮类抗生素。
We can't use penicillins or cephalosporins because the bacteria do not have a cell wall, and those drugs target the cell wall, so they will not be useful. So no amoxiclav.
然后呢，绝对不能用青霉素或者是头孢，因为这2类的抗生素它们都是就是主要攻击的是细胞的细胞壁，但是因为支原体没有细胞壁，所以它们是完全没有效果的。
So Doxycycline has the most data for being effective against Mycoplasmas, and usually it will make the symptoms of infection go away after 1 week.
然后多烯环素是目前来讲比较就是有比较多的这个数据支撑它是比较有效的，然后一般来讲在1周内就可以减轻或者是治好这个临床的症状。
But although the symptoms have gone away after 1 week, it can take over 28 days and up to 42 days for a cat to actually test negative for PCR for Mycoplasma.
虽然说可能临床上面1周就会见好，但是很可能说需要更长的时间才，比如说甚至长到28天以上，才会最后能化验出来是 PCR 阴性。
So for that reason, we usually end up treating for 6 weeks with Doxycycline, and I use the dose of 10 milligrams per kilogram twice a day.
所以很经常的是猫支原体感染的时候，我会用到是就是6周的这个多烯环素，用6周的时间42天，然后我用的这个剂量是每公斤10毫克，然后每天2次。
So you have to be careful. I don't know what you have available in China, but we used to have a product called Vibravet, which was doxycycline monohydrate. I don't know if that's available. I don't know if anyone can answer that, or if you have to use doxycycline dihydrate. Anyone know?
有一个问题就是我不太清楚国内就是这个多烯环素是什么样子的，然后在这边的话，我们用的是一个叫 Vibravet 的这样一个这种多烯环素，不知道国内有没有就是这样子，不知道大家就是手上多烯环素是什么样子的。
有的，国内有多烯环素。
国内是片剂比较多一点。但是我们国内不会给这么高的剂量，正常我们是按照每公斤体重10毫克1天1次，或者按照每公斤体重5毫克 BID 这样去给。老师说是每公斤体重10毫克给 BID 这个剂量有点高呀。
Okay, so we've got an answer here. So in China, it's mostly a tablet form. So I don't know if that means it's usually the dihydrate, possibly.
Yeah.
And yeah, so the dose he was referring to is it's not as high as what you've just suggested. So they usually use 10 mg per kg once a day or 5 mg per kg twice a day. That's the dose he was referring to.
Well, now you've made me think I've got it wrong.
然后 Kate 说他会再查一下他的那个剂量是不是对的。
No, I think
You won't have.
No, I think I might have. I do 50 milligrams. Okay, you've made me think. I'm just looking it up.
可以现在就查一下他的这个剂量有没有搞错。Is there a difference between the mono and the di?
Yeah, so the difference between the mono and not between the dose, no. The difference is the safety. So hang on a sec. The monohydrate one is not associated with esophageal strictures. So whereas the dihydrate one is. So and in New Zealand now we can only get the paste, which is the monohydrate. But if you're using it for 42 days, the paste is often cost prohibitive for people. So we use the doxine tablets. I'm going to come back. No, you're right. It's once a day.
So 10 mg once a day.
Well done, that person.
所以非常感谢刚才指出来这个剂量的问题，然后 Kate 刚才确实说错了，他用的这个剂量是每公斤10毫克，然后1天1次的，所以就是跟刚才说的这个剂量是一样的。 然后刚刚他提到的是，就是新西兰的这种就是多烯环素是一个就是叫什么，就是胶体也不是胶体，就是有点类似就是固体液体那样子的，就不是片剂，然后就可以挤出来的那样子的。这种的话，就是它跟国内的这种片剂可能一个比较大的区别就是，片剂会对就是食道，就是造成这种狭窄，食道阻塞会可能有这样的一个副作用。但是片剂会便宜一些，所以如果是要用到6周的话，片剂是确实会比较经济实惠一点。
Okay, thank you. So the other options for antibiotics are the fluoroquinolones, preferably pradofloxacin or marbofloxacin, because enrofloxacin can cause ocular toxicity, especially over that period of time.
然后如果是用氟喹诺酮类的抗生素的话，建议使用普拉多沙星或者是马波沙星这两种，然后不要用恩诺沙星，因为恩诺沙星会有更高的这个造成眼睛的中毒、眼睛的毒素的这样的一个可能的副作用，尤其是如果用药这么久的话。
And you can also use macrolides, so your azithromycin and clindamycin, and they work well. It's just that doxycycline has the most evidence for it, and so that is the one that I tend to use first.
然后也可以用就是聚环素或者大环内酯类的抗生素，比如说克林霉素是吧？但是就是因为多烯环素是有比较多的数据支撑的，所以这个是 Kate 他会建议就是比较常用的。
And finally, it's part of treatment too. We can't forget nursing, and that's especially important with upper respiratory tract infection. These cats need lots of face wipes and warm, wet food to eat. And also, if they've got upper respiratory infection, I always ask the owner to put them in the bathroom with them when they have their showers so that they get some steam.
然后除了就是用药之外，还特别要注意的就是对于上呼吸道疾病的这些猫的护理是非常非常重要的。就是一个是要经常去把它们这个就是眼睛啊这样的分泌物，就是上呼吸道分泌物擦干净，然后给他们就是提供这种就是温热的，就是比较好闻的这种就是食物，这样他们的食欲会好一些。然后还有就是经常会建议主人在他们洗澡的时候把猫也放到洗澡间里面，这样可以就是让他们的这个呼吸道就被蒸汽给打通一下。
Does anyone have any questions about that aside from my dosing mistakes?
对于支原体的治疗，大家有其他的问题吗？除了刚才的这个就是剂量的问题之外。
请问一下老师，支原体感染然后导致猫的那个结膜炎，除了口服给予多烯环素以外，在眼部有没有什么用药治疗？谢谢。
Okay, so the question is for Mycoplasma infection that causes a conjunctivitis in cats, apart from the oral doxycycline, do you put anything in the eye, like ointment or anything?
I actually don't. I tend to, other than lubricants. So because the doxycycline is excreted in the tears, so I will use doxycycline and then a lubricant, just a lubricating gel, sort of 3 times a day.
所以因为多烯环素它是可以在这个眼泪里面分泌出来的，所以Kate说它不会额外的再用任何的就是这个眼睛上面的上药，但是他会建议用就是这种有点像是就是泪液吧，这种润滑剂，每天3次，这样就是为了让眼睛保湿吧。
And I'd also be really making sure that the problem wasn't viral and it wasn't herpes virus or chlamydia or calicivirus, because just the same reason in the lungs that Mycoplasma will look like it's a pathogen, but it's actually just a bit of an innocent bystander to another disease.
然后另外一个，如果是看到就是有眼睛上面的这样症状的话，还有就是一定要确定不是病毒造成的，不是那个就是叫什么杯状病毒这样的这些病毒造成的。因为有的时候如果就算你有就是检测出来支原体，但可能支原体并不是造成这个病症的原因。
Any other questions?
还有其他的问题吗？
No. Okay. So I'll go on to the next question, which is, well, I put two of your questions together. So somebody asked about a prognosis for ivermectin poisoning, and someone else asked about what to do with paracetamol poisoning, and I've put those two together.
所以接下来第二个问题是因为分别有人问到，一个是伊维菌素中毒的猫，它的预后效果就是预后的这个可能怎么样？然后另一个问题是扑热息通中毒的猫，我们要怎么治疗？所以他把接下来这两个问题放在一起了。
One of the reasons for that is both of these toxicities are awful things to happen to cats, and one of the reasons for that is because often they haven't eaten or accidentally ingested these toxins.
所以为什么要把它们都放在一起呢？就是因为这两种中毒对猫来讲都是非常严重的、非常可怕的一种中毒。然后经常性的是猫它们其实没有怎么吃东西，然后就是不小心就吃下去了这两种东西。
Usually, both paracetamol and ivermectin have been administered deliberately. Paracetamol by owners and ivermectin either by ourselves as vets or as a topical product that a cat has then accidentally ingested.
然后这两种伊维菌素和扑热息通中毒，经常性的就是人为造成的。如果是扑热息通这种止痛药的话，很可能是主人不小心喂给猫的。然后伊维菌素的话，有可能是兽医不小心就是作为一个体外驱虫的药，然后滴到猫身上，然后猫它们再自己舔进去的。
And so what that also means is we don't often see them very early on. Either the owner doesn't know they've done something wrong with paracetamol, or we don't realize they've ingested ivermectin until they've become unwell. So we don't often have time for early interventions such as emesis and charcoal.
然后因为这样的原因，很经常的情况是在猫中毒之后不会及时的就能带到兽医那里，有可能是因为主人他没有发现说扑热息通其实是对猫有毒的，或者说是猫在舔进去伊维菌素之后呢，也没有及时的就被发现，所以等他们到兽医这里的时候已经很少有机会还能再有时间催吐或者是给他们活性炭了。
So with ivermectin, just a wee recap that it crosses the blood-brain barrier and affects the brain and causes mainly neurological signs, seizures, twitching, coma, and but also gut signs and bradycardia.
然后简单的复习一下这个伊维菌素，它造成中毒的原因是它会穿过这个血脑屏障，然后会就是影响这个神经受体，所以常见的这种中毒的症状是以这个中枢神经系统的症状为主要，然后包括癫痫呀，然后抽搐呀，昏迷，然后其他的还包括有就是肠道的症状。以及就是心动过缓呀等这种心肺方面的症状。
So if you're lucky enough to see these early, you can make cats vomit using xylazine. We have xylazine in our clinic only to make cats vomit, because I still find it the most reliable drug to do this. And you can also carry out gastric lavage and try and administer activated charcoal if you get them within the first 1 to 2 hours.
如果是在伊维菌素中毒的就是头1-2个小时能及时的去治疗的话，也可以催吐。然后催吐的话，最好用的一个药就是塞拉嗪。所以在 Kate 他们的这个医院里面，就是有这个塞拉嗪这个药，唯一的原因就是为了给猫催吐，因为是非常好用的。然后其他的如果是在这个1-2个小时之内发现的话，可以洗胃和就是给予这个活性炭治疗。
And if they've already got clinical signs, which most of them do because of the reason that they've had the toxicity in the first place, then it's just really intensive supportive care on an individual symptom basis. So if there are seizures, you need to administer diazepam IV to control them. If they're bradycardic, you need to administer atropine.
但是因为刚才提到的原因，所以大部分情况呢，我们在发现猫中毒的时候，它们已经有这方面的症状了，所以这个时候就洗胃啊这些都没有用了。所以这个时候最重要的就是辅助治疗，就是根据每一个不同的病患，他们所表现的这些症状，然后去给他们就是个体的这种治疗，比如说是就是去控制这个癫痫的症状呀，或者说是其他的这样的，就是根据他们的这个症状来治疗。
And some of these cats will not be able to regulate their temperature. Some will be too cold, some will be too hot. Some of them will go blind. You can help with their temperature regulation. The blindness is usually temporary. All of these cats should go on fluids, mainly for hydration and cardiovascular support.
然后如果是他们心动过缓的话，心跳比较慢的话，可以给他们阿托品。然后有一些猫，很多猫它们没有办法保持自己体温的恒定，所以有的猫可能会过热，有的猫可能会过冷。这种时候就要就是保持它们体温的正常。然后还有就是所有的这些中毒的猫都应该接受这个静脉补液。主要的是为了就是不是为了排出这个毒素，但是主要是就是为了补偿它们的这个液体，还有就是给这种心血管系统的支撑。
And then specifically for ivermectin toxicosis or the mectins, then you can also use intravenous lipid emulsion therapy.
然后特定的对于伊维菌素的治疗的话，你也可以使用静脉的这种脂肪的注射液。
And so lipid emulsions are made for human use. They're usually for intravenous nutrition, but they're also very good at binding up the ivermectin and removing it from the system. However, giving it to cats IV can have severe side effects, such as anaphylaxis and hemolysis.
这个静脉脂肪乳这种治疗方法是一开始是给人类的就是人医里面用来给予这种营养支持的。但是它也对于中毒，然后去把这个毒素给吸附在这样的静脉的脂肪里面也非常有用。对于猫来讲，它们可能会有一些比较严重的副作用，包括说是就是很严重的过敏反应等等，所以这个是需要小心的。
So if your cat is stable and it's not looking like it might actually die, then I wouldn't use it. I would only reserve it for those cats that are so seriously toxic that you think you're going to lose them, because you don't want to kill them with your lipid emulsion.
所以就是因为有这种很严重的过敏反应的可能性，这样的这个静脉脂肪乳的这种治疗方法只会用在就是非常非常严重中毒的猫身上，就是这些猫它们可能就是中毒严重到很有可能会死掉的时候才会用。 就是为了不要因为治疗然后反而导致这些猫的就是严重的副作用死亡。
I have the dosage and the regime here if anyone is interested. It's not quick to describe, but it also needs to be instituted probably within the first 6 to 12 hours of ingestion of the ivermectin.
我这里有这个就是具体的怎么用静脉脂肪乳的这样一个方案，如果有人感兴趣的话，可以就是讲一下或者是发给大家。然后同样的这个静脉脂肪乳的疗法也是在中毒之后的6到12小时之内使用最好。
And then there's a few guidelines about prognosis and what might get your cat through. The length of time after exposure to the onset of clinical signs can predict whether they will survive or not. Those patients that get symptoms of toxicosis within the first 4 to 6 hours usually are less likely to survive than those that have a delayed onset of 10 to 12 hours after ingestion or injection.
然后关于伊维菌素中毒的，就是预后的这样一个预计的话，有一些这方面的就是指南吧。如果说是这个猫它在就是吃下去这个毒素之后的就是很快就发展出来这样的中毒症状的话，比如说在一开始的4到6个小时就出现中毒症状的话，一般来讲这样的猫它们的这个就是预后的效果会不那么好，就更有可能有很严重的这个中枢神经系统的损害。
And another good guideline is that if you can get them through the first 24 to 48 hours, then there is a good chance of a full recovery, provided you can keep up that hospitalization support, which can have to take weeks. It can sometimes mean weeks in hospital with all that level of support. But if they're alive after 2 days, you will probably be able to get them through.
另外一个指南就是，如果你能让这个猫就存活，在中毒之后至少活了2天的话，一般来讲它们就会有一个比较好的就是预后的可能性。虽然说之后的这个住院和辅助治疗可能还需要就是长达数周的时间才能让它们完全的恢复。但是一般来讲，如果能活过一开始的这个1到2天的话，那很有可能他们能活下去。
Does anyone have any questions about ivermectin toxicity specifically before I move on to paracetamol?
刚刚漏掉了一点，就是还有一个就是伊维菌素的中毒症状，就是暂时性的这个失明，一般是暂时性的。然后关于伊维菌素这方面还有其他的问题吗？
伊维菌素这个问题是我提的，我想问一下老师，他说的这个暂时性的失明啊，是指哪方面？是因为它中枢神经系统，还是因为它视神经视网膜这方面？所以老师会认为它是一个暂时性的失明。因为之前我碰到一个病例也是的，急性中毒，然后将近16小时以后才送到医院来的。
Okay, the question is about the temporary blindness. So the question is on whether that is due to the CNS involvement, or why is there blindness? What's the cause of that? Because he's actually seen a case before, and the cat was ivermectin had ivermectin toxicity and was only presented 16 hours after ingestion.
Yep.
And was blind.
16 hours. Was it 16 hours? Yeah.
16 hours,
yeah. Yeah. That's seen quite frequently, especially when ivermectin is put down the ears as a mite treatment, so used topically down the ears. And yes, it's to do with the effect on the CNS. It's a retinal thing. But I've never seen one that has stayed blind. Is he saying it's stayed blind?
对，这个，失明的原因是因为神经系统方面的，然后，比较常见的一个情形就是，如果主人他，把这个，异维菌素滴到耳朵里面，就是为了治耳螨或者怎么样，错误用药的话，就会比较常见，会造成这种失明，是跟视网膜有关，因为影响这个，神经系统。但是一般来讲，Kate 他没有见过就是有任何一例是一直都失明的，所以一般都是暂时性的失明，然后后面视力会恢复。所以刚才提到的这个问题的医生，那只猫它是一直都就是还是失明吗？还是说后面就恢复了？
这只猫当初来医院的时候，它已经呈现双眼的瞳孔散大，然后对光反射、微褐还有眩目反射都是阴性。另外的话，它因为中毒时间比较久，然后剂量比较大，它是因为主人买的那个网上的异维菌素，然后涂在脖子上面，但是量滴多了，那个药水就流下来了，然后被猫咪所舔到了。所以来到医院的时候，它是呈现一个失明跟肌肉震颤的情况。我们所做的检查，包括的用药，都是给了镇静，然后才能操作，因为它肌肉震颤会比较厉害一点。当天给它是做了眼科的检查，包括眼底的检查，还有视网膜的检查。它的眼底跟视网膜检查其实都是有异常的，但是它这个病转归还是比较快的。我差不多治疗了3天，其实在第2天的时候，它的瞳孔就慢慢开始恢复正常，然后对光反射也有。到第3天的时候，基本就是已经失明的症状是不存在的。然后，但是我做眼底检查的时候，它的眼底还是有些异常，所以老师说那个暂时性失明，我就不知道什么时候就是再去复查，它的眼底啊或者视网膜能回归到正常，它只是现在视力是 OK 了。
Okay, so like briefly, so the case he was just saying, it was a temporary blindness as well, and when the cat first presented, it was due to like a really high dose of ivermectin, the owner bought online, and yeah, so the cat both like licked it and probably went into the ears as well, I guess. So both blindness and like kind of twitching and just like convulsion kind of signs as well on presentation. So they when they did like an intraocular exam, so they saw both the retina and like at the back of the eye, there were abnormalities. And 3 days afterwards, the cat started to like get better and recover some of the vision as well. And yeah, so it was a temporary blindness. And he was wondering, so with the temporary blindness, when would you recheck like the retina, and when would you repeat your ocular exam just to make sure the eye is normal?
The eye is normal. It's very variable. So the course of the toxicity can be short and sharp and lead to death, or it can be really prolonged, and the blindness can be it can come back quite quickly, but it can also, they can be blind for weeks and then it comes back. So it's very variable. So I'd be checking them. If the blindness was the only symptom, I'd probably just check them once a week or once every couple of weeks. Yeah.
Okay.
I'd have them on an anti-inflammatory though as well. Sorry.
So 所以刚刚Kate 医生他说的是，其实也不能就是一概而论吧，有一些猫可能是非常快的就能恢复视力，就很快的就能变好这个视力，然后有的猫可能会持续数周都失明，所以如果失明是这个猫可能是异维菌素中毒的唯一症状的话，那可能每周检查1次，然后就可能是一个合适的频率，就是看病患吧。然后同时也给他们用这个抗炎药。
Okay. Are there any other questions?
还有其他的问题吗？
Okay, I'll keep going. So the next part of this question is about paracetamol toxicity and what to do about it. And this question makes me very sad. I have never had a cat with paracetamol toxicity survive. So although I know in theory what we're meant to do about it, I've never managed to successfully do it.
然后接下来要讲的问题是扑热息通中毒，然后 Kate 医生他从来没有一例这个扑热息通中毒的猫活下来的，所以是一个挺让他伤心的病，对。
And the reason for that is because usually the owner has administered the paracetamol not knowing it's toxic. And by the time the cat is sick and at the vet clinic, it is far too late to do anything about it.
原因是因为经常性的情况是主人给猫吃了这个扑热息通的这个止痛药，然后没有意识到说猫它确实是中毒了，所以等到带到医院来的时候都已经太晚了，就没有办法把这个猫救回来了。
In fact, most of the ones I have seen haven't told me that they have given their cat paracetamol, and I have had to specifically ask if the cat has had paracetamol. So it can be very difficult. These cases, the owners feel guilty. I'm always feeling pretty gutted as soon as I find out that it's happened. And the toxic dose is only 10 mg per kg, so that's a tenth of a human tablet. So when people have given it, they've usually at best given it half a tablet, and it's often too late to help them.
然后经常性的主人都不会就是直接说出来说哦，我给我的猫喂了这个扑热息通片，经常是可以需要他特别的去问是不是有给这个猫吃这个人用的这个扑热息通止痛药。然后很多的主人他其实是会觉得非常内疚的，然后因为是自己造成的，然后对于猫来讲，这个中毒的剂量是非常小的，是每公斤10毫克就会导致中毒。所以一个普通的猫5公斤的猫的话，只需要人的这个止痛药的1/10片就足够达到这个中毒的剂量。然后一般来讲，主人喂的时候，可能最少也会至少给猫吃半片儿，所以就是非常大的一个剂量了。
But we'll pretend that we have a cat that we get nice and quickly, and we can maybe help. So the paracetamol affects the red blood cells, and the reason it does this is because the liver of the cat cannot metabolize it, and there is a very toxic byproduct produced, and that directly damages the red blood cells by oxidative damage.
然后但是假如说最好的情况是我们在这个猫吃了扑热息通药之后，非常快就能在医院里面看到它们的话，还是有可能可以就是治疗它们的。然后扑热息通它是影响这个血红细胞，它会造成这个氧化的伤害。因为猫体内没有这个可以代谢扑热息通的这样一个酶。
And there's two reasons why this is particularly bad for cats. One is that they can't metabolize, their liver can't metabolize the paracetamol, but also their red blood cells are more susceptible than other animals to free radical damage. So and what happens to those red blood cells is they develop a met hemoglobin anemia, so and they can't carry oxygen around the body anymore.
对于猫来讲，扑热息通是非常致命的2个原因，一个是它们没有这个酶，就是它们的这个肝没有办法代谢扑热息通这个药，然后另一个原因是它们的血红细胞对于这种自由基造成的氧化的伤害是非常敏感的，就比其他的动物来讲会更容易就是受到氧化的伤害。然后这样的会造成的是它们的这个血液没有办法携带足够的氧气。
So the most common symptom is from the met hemoglobin, and that is chocolate colored or muddy brown colored mucous membranes.
然后因为扑热息通造成的这个血液对血细胞的影响，会造成高铁血红蛋白这样一个症状，所以它们的血液是会呈现出来这种巧克力棕色，或者是就是很深棕色这种颜色。
So if your cat has following the red blood cell issue, the cats will develop liver failure. If your cat has liver failure, it is too late, and all you can really do is recommend euthanasia.
如果说猫呈现出来这个肝中毒的症状的话，这样的话，这个病程已经太晚了，这种情况呢，会建议安乐死，因为就没有办法再治疗回来了。
And obviously, if you do get a cat presented to you within 2 hours of having been given the paracetamol, you need to induce emesis. And if you can't get the cat to vomit, you need to do aggressive gastric lavage, because otherwise the cat has a high chance of dying.
如果在扑热息通就是吃下去之后的2小时之内，能去接诊这个猫的话，一定要给猫催吐。如果没有办法，就是让这个猫把这个药给呕吐出来的话，一定要给它洗胃。否则的话会有很高的这个可能性，这个猫会死掉。
And failing that, you need aggressive oxygen support. So an oxygen cage, good fluid therapy, possibly blood transfusions, or at least be ready to do blood transfusions, as well as a couple of other supportive measures that I'll go into shortly.
如果没有办法催吐，也没有办法洗胃的话，至少也要用这个非常强力的氧气治疗，比如说是一个就是输氧舱，然后也要有可能会需要输血，或者说至少要准备好有输血的这个可能性，然后还有很多其他的一些辅助治疗的方法，接下来会讲。
So the main other thing you can do is use N-acetylcysteine, which is a source of glutathione and can help artificially continue to metabolize and excrete the paracetamol where the liver is not able to.
然后其中的一个可以治疗的方法就是用这个叫 N-acetylcysteine. I'm not sure how to translate that. Annie 知道吗
？N 乙酰半胱氨酸，乙酰半胱氨酸。
可以用这个来治疗，因为它可以就是可以作为这个叫谷胱甘肽的这样一个来源，所以可以帮助猫代谢这个毒素。
So that's available as an oral formulation or IV, but you're not going to be able to get oral formulations into your very sick cat. So you should be using it IV. And the dose is 140 milligrams per kilogram. And then every 4 hours, 70 milligrams per kilogram, up to 5 treatments.
所以这个 N 乙酰半胱氨酸，它可以用2种途径，一个是口服，一个是静脉注射。如果猫非常就是病得很严重的话，是不太可能就是口服让它吃下去的。所以一般来讲是从静脉注射来开始，然后它的剂量是口服的话是每公斤140毫克，然后Sorry, is the IV dose 70 mg per kg?
Yeah, the initial one's 140 mg per kg, followed by 70 mg per kg every 4 hours.
所以一开始的剂量是 不管口服或者是静脉都是每公斤140毫克来开始，然后之后是每4个小时，就需要去再注射或者是口服，然后接下来的这个剂量是每公斤70毫克，然后一共治疗5到7次。
The other thing we can use that can be protective, but probably isn't going to be the difference between life and death, is S-adenosylmethionine. We call it SAMI for short.
然后另外一个就是可以用来治疗的，但可能不是像那个 N 乙酰半胱氨酸那么必要的是另外一个叫做 S 腺苷甲硫氨酸这样一个药，然后就是缩写是叫 SAMI。
Yeah. Other than that, just supportive care, but honestly, I've never had one survive. I'd love to know if anyone has had one that has lived.
然后除了这2种药之外，就真的只是辅助治疗，来去尽量保证这个猫能存活。但是Kate 她说她还没有一例这个病例是真的活下来的，所以她想问大家有没有就是扑热息痛中毒的猫然后活下来的病例。
No. Yeah, it's not a very rewarding thing. They've also tried vitamin C and methylene blue. Neither of those have any evidence that they help either.
然后还有一些可能可以使用的药，一个是叫什么亚甲蓝，或者是维生素 C，但是没有证据支持说它们确实有用。
Does anyone have any questions about the paracetamol?
对于扑热息痛，大家有其他的问题吗？
No. Okay. So I'll move on to the case study that somebody gave me, which is a really good one. This is about Toy, who's a 4-year-old male neutered Abyssinian cat.
好，那接下来呢，我们来学一个关于这个病例的一个内容。然后这个病例的话，它这个叫做 Toy， 然后是一个阿比西尼亚猫。
And he's had soft stools for several months, and his fecal exam showed flagellates. So he was treated with metronidazole for 14 days. Okay, Annie?
Yes. 它这个软便的话有差不多好几个月，然后在便检的时候发现里面有鞭虫，然后最开始治疗的时候用甲硝唑治疗了14天。
And so the bleeding improved, but he still had soft stools, and there was a small amount of flagellates that were identified as Pentatrichomonas Hominis visible on the recheck.
那在这个治疗2周以后呢，它这个出血稍微有一些改善，但是仍然是有软便。在这个复查的时候呢，发现这个鞭虫，然后复查的时候鞭虫它发现是胎儿三毛滴虫。
Sorry, come here. So he was treated with ranitidine for 2 weeks, fed a high fiber diet. His feces did get a bit better, but then came back again, and T fetus was found again on the microscope exam.
那因为他发现有这个再次发现有这个滴虫，所以呢就是用这个罗硝唑来治疗2周，然后呢又给了这个高纤维的处方粮，然后就是它这个粪便偶尔的会成型，但是仍然是还是会比较软。
And so this has gone on for 2 years. Apparently, the original dose of ranitidine was 30 mg per kg, and also there was giardia there at the beginning.
那就是它后面的话就是这个便便偶尔会成型，但是主要还是会有些软，然后2个月以后再次复查，然后就差不多这样是 持续了2年的这样的一个时间，停药了2个月又开始软便，然后便检是可以看见有这个胎儿三毛滴虫。然后呢，就是最开始诊断的时候反复了2年，然后后来在这个检查的时候呢，有诊断说有这个甲地鞭毛虫和这个胎儿三毛滴虫。
And this is my cat Beanie. He's come to say hello. Okay, hello
大家
everyone.
可以看到，大家可以看
He'll
到
let
老
me.
师的猫。
Okay. So the question was, is there any other treatment for T. fetus other than ronidazole, and can it be combined with other options such as prescription food and probiotics, etc.？
所以呢，这个问题就是说，除了罗肖唑以外，有没有其他这个治疗胎儿三毛鞭虫的这样的一个方法然后这个治疗方法可不可以用其他的一些方法来进行结合的一些使用，比如说这个处方粮啊，然后这个益生菌啊这一类的。
So the very short answer to that question is there any other treatment is no.
这个对于这一个问题的简要的回答是说，没有。
But I think there's still a lot to be done here in terms of maybe moving forward with this cat. And the first question that I think needs to be asked is T. fetus the disease that needs treating here? So is the diagnosis correct?
好，那你就是除了这个虽然说刚才说这个没有其他的这个治疗的方法，但是呢，在这样的一个病例下，其实是有一些其他的问题，我们是可以来探讨的。第一个问题，我们需要考虑的是，那我们这个真正需要治疗的这个病原体和疾病是不是真的是胎儿三毛鞭虫？我的诊断是不是正确？
So some healthy cats can carry T. fetus and shed flagellates in their feces without it causing disease.
那就是有很多的情况下呢，这个猫咪它可能是携带着鞭虫，但是呢没有表现出症状。
So instead of a cat that is not responding to ronidazole treatment, you might have a cat that has diarrhea for a different reason that happens to have T. fetus in its colon.
那有些时候的话，就是虽然说这个它会有滴虫，但是不出现症状，但是后来我们发现，哎，这个猫好像是有的猫进来，它的确是有这个腹泻的症状。那这个时候我们就要考虑，那我们这个便检的时候发现胎儿三毛鞭虫，它到底是因为滴虫的原因导致这个猫咪有腹泻呢，还是说它有其他的原因导致猫咪有腹泻？
So to work out whether that's happening, because you know that the cat has T. fetus, you don't need to do tests for that. But does the cat have large or small intestinal diarrhea?
那就是我们要考虑，就是说这个猫咪它是大肠腹泻呢，还是小肠腹泻？就是说，我们这个便检里面发现有滴虫了，好，那我们以后也把这个事情记在脑海里就好。但是我们要考虑一下其他的原因。
So large intestinal diarrhea has frequent passing of small amount of feces, and cats tend to maintain their weight and appetite.
那对于这个大肠腹泻来说的话，绝大多数情况下，猫咪它是排这种少量的这种便，但是呢，就是说它这个频率会增加，然后它这个体重一般来说是维持一个正常，然后这个食欲也是正常的。
Whereas small intestinal diarrhea will be large volume feces, not very often. There may be weight loss, vomiting, inappetence, which would suggest there's definitely disease outside the colon.
那就是对于小肠腹泻来说，它排出来的这个粪便量经常都是非常大量的，然后频率的话不一定会那么的高，它可能只是比较少的一些频率。然后小肠腹泻的话，经常会有体重的减轻，然后还会有呕吐，然后食欲也会经常会受到一些影响。所以就是如果它这个是小肠腹泻有的话，那可能就是不仅仅是这个结肠炎的这样的一个问题。
So I'd be wanting to go back and getting a bit more of a minimum database. So blood testing with a complete blood count, biochemistry, and retroviral testing.
所以在这个情况下的话，可能会再回去搜集一些病例的一些其他的基本数据比如说它的这个CBC 是怎么样的，它的生化的检查是怎么样的包括说是这个逆转录病毒，它有没有做这样的一些类型的测试，它这个结果如何。
And I'd also be checking for other fecal pathogens. So I'd be doing an egg count, but also sending it for Giardia ELISA testing, PCR testing for Campylobacter, Coccidia, Clostridium.
然后还会考虑做一些其他的一些粪便的一些检查比如说会来数一下这个粪便里面寄生虫的虫卵到底有什么样到底是怎么样，然后呢会考虑做这个甲地虫的酶联免疫吸附实验或者呢是做这个PCR 实验，做这个逆转录的实验，然后来针对甲地鞭毛虫这个弯曲杆菌，然后这个球虫，然后包括梭菌对于这些后面几个病原来做这个逆转录做这个PCR 实验。
And then I'd also do an abdominal ultrasound. The last cat I had with chronic diarrhea that kept coming back, it was Giardia positive and non-responsive. When we did an abdominal ultrasound, we found a thickening in its colon that ended up being FIP.
然后有些时候有可能还会有些其他的一些这个疾病就是需要来考虑的。之前这个老师有过一个病例他这个不断的在这个持续性的这个腹泻，然后呢就是说他们发现是有甲地鞭毛虫，但是呢他治疗以后并没有出现一个很好的一个应答，然后做了这个腹部的超声以后，发现他的这个肠道就是肠道的这个肠壁它是增厚的，然后最后这个猫咪是确诊其实它是有传腹。
And that particular case had been seen by another vet who just kept looking at the feces and the feces and the feces. And when we looked at the cat as a whole and did the biochemistry and the CBC and the ultrasound, we ended up diagnosing dry FIP. So it's important to make sure that the T fetus is not taking you away from the real problem underneath.
那就是刚才提到的这个病例，最后诊断为传腹的这个病例的话，最先转诊的这位兽医，他最主要的这个检查的这个方法呢，就是说做便检，做了很多次的便检，但是呢，就是等到转到Kate 老师这里的话，他们做了 CBC， 做了生化，做了这个很多的一些其他的测试，腹部的超声，最后这一系列的这些诊断下来，然后就是这个猫咪其实它是一个干性的传腹，所以说就是在虽然说便检里面可能会发现有些寄生虫它这个鞭虫或者其他寄生虫，但是就是我们不要因为发现有这些寄生虫，然后忽略了其实它真正的问题是一些其他的一些更大的问题。
So provided that all of that testing is normal and there is no other disease outside the bowel, then you can come back to looking at the feces again.
那就是说我们刚才提到的所有这些检查，如果所有这些检查它的这个结果都是正常的，那就是说它不是肠道外有一些其他的这些问题导致它腹泻，那我们就可以回过头来再来考虑我们的这个治疗然后来考虑我们这个病例的本身其他的一些方面。
And there's one more pathogen in the feces that can get confusing. So you've got Giardia and T fetus, but there's also something called Pentatrichomonas hominis. Now that is it's a human flagellate that can be a commensal in some cats, and it looks like T fetus.
然后刚才提到的这些病原，我们提到了一个甲地鞭毛虫，另外提到了这个胎儿三毛滴虫，然后在猫的里面呢，还有一个病原我们是需要提到的，这个病原叫做人的五毛滴虫这个就是人的一个寄生虫，但是它在这个猫咪的里面有些时候可能是共生的一个寄生虫，所以就是它们需要看起来可能会比较类似，然后需要进行区分。
And because that human organism is a Trichomonas, you cannot tell the difference under a microscope between that and T fetus. The only way to tell the difference is by PCR testing, looking for both of them.
那就是人的五毛滴虫，它也是滴虫。那我们的胎儿三毛滴虫也是滴虫。光在显微镜下来看的话，其实是没有办法进行区别的。我们的这个正常的常规显微镜没有办法做区分，所以就是我们需要来做这个 PCR 聚合酶链式反应来进行检测，看这两个病原是不是同时存在，还是只有一个。
So provided you've ruled out everything that I've just mentioned, then you come back to your rinidazole treatment. And sometimes this can be very frustrating, and there's definitely some cases that don't respond, but there's, I think, 3 things you can look at that might help get a reason why your cat hasn't responded or what else you can do.
那我们就是排除了所有的这些病原或者是所有的这些其他的这些疾病以外呢，我们再回过头来考虑以下的这些几个问题。那有些时候就是在这个治疗的过程当中，然后这个病例反反复复的，会让我们觉得非常的有受挫感，但其实就是还是有一些问题我们可以来继续来讨论，来继续来考虑，来分辨，然后继续的往下走的。
So the first question is, was your treatment adequate? And your dose you've given, 30 milligrams per kilogram once a day for 14 days is the best dose, and longer duration or higher doses have not shown to be any better.
那第一个问题我们要问的就是说，我们的这个治疗是不是充分的，是不是足够的？那在这个病例当中，这个医生他所使用的剂量呢，它是30毫克每千克，每天1次，然后连用了14天。那这样的一个剂量和这样的一个治疗方案的话，其实是非常好的，是就是最有效的一个治疗的这样的一个规程。那就是说我们在用更长的时间或者用更高的剂量，其实也并没有显示出有更好的一个治疗的效果。
You also want to make sure that you're using a gel-coated, capsule. Early on in the treatment, the main form of rinidazole came in a powder that was to put in the food of pigeons to control the parasites, but you really want to use a proper gel-coated capsule in these cats.
然后呢，另外一个需要注意的就是说，我们在用螺销唑的时候，请确保就是说我们使用的话是一个用这个凝胶包裹的这样的一个胶囊来喂这个猫咪，而不要去用这种粉状的这种药剂。就是说最先这个螺销唑出来的时候，它是一种粉状的这样的一个药剂，然后添加到食物里面，然后让这个动物吃下去。但是就是这样的药剂形式是不太合适的，是需要用这个胶囊。
And finally, in terms of whether treatment was adequate, was there compliance? Are you sure the owners administered the drug every day for 14 days? Because if there's any issues there, you may need to do another course. I've hospitalized cats with T fetus before because I've been concerned that owners haven't actually been giving the medication properly, and that's been the difference between the treatment working and the treatment not working.
然后还有一个需要进行考虑的，就是说这个主人的顺应性是怎么样的？这个主人真的是按照兽医的指示，这个遵医嘱来喂药吗？还是说他可能有些时候想起来喂，有些时候想不起来，或者说有些时候喂不进去，或者是喂得进去？那原来老师他是有把这个猫咪来住院让他住了2周，然后就是因为他有考虑到就说这个猫咪的主人是没有办法把这个药物按照要求来喂进去的，所以这个是主人的顺应性是需要来考虑的。
And so the second question you can ask, if you're confident you've got T fetus and it's not going away, is the cat getting reinfected? So is the cat isolated from all other cats, or could it be living with a carrier cat?
然后那我们在确保了说我们的治疗很充分，然后也没有其他病源，下一步需要考虑的就是说这个猫咪是不是再一次发生了感染？那针对这个问题的话，我们要考虑说这个猫咪它是不是处于一个被隔离的一个状态导致它再次感染？它有没有可能是在与这个没有症状的携带者这样的一起生活
And the other reason why reinfection could be occurring is if there's not adequate hygiene around the litter tray. So the litter tray needs to be cleaned every day with soapy water and dried thoroughly in between bowel motions. Otherwise, reinfection will occur even though ranitidine is on board.
还有一个需要特别注意的话，就是这个猫砂盆是不是有这个非常严格的遵照这个卫生的条例。也就是说，我们不仅仅说是要把这个粪便给它不仅仅说把这个铲屎铲出去就好了就是说这个每一次在清理猫砂盆的时候每天其实是需要用这个消毒水，然后把它彻底的来清理，然后进行消毒，并且的话就是说这个猫咪它前一次排便以后，后一次的排便以后，其实也需要及时的进行清理，进行这个消毒。否则的话，即使是说是在用了罗肖唑，那个猫咪也有可能会再次的被感染从这个粪便里面排出来的寄生虫。
So if you're confident that it's T. fetus, your treatment has been adequate, and that reinfection is not occurring, then you are left with a scenario of treatment failure, which is actually really common.
那就是如果我们排除了治疗是否是充分的，我们已经考虑了。然后另外的话，这个猫咪也不是说再次发生了感染。那下一个需要考虑的问题，那就是说它有可能真的是存在一个治疗失败的这样的一个情况。然后这个治疗失败的情况其实概率还是蛮高的。
And I think it's worth saying that when you're monitoring for T. fetus, the case study mentions a lot of looking down the microscope, which is really great. But I would also be considering PCR testing, especially when you're trying to rule it out. Looking down the microscope is often quite insensitive, so you'll get lots of false negatives. So if you think the cat has become negative, I would definitely do a PCR to ensure that.
然后就是说，我们经常做便检的话，可能就只是止步于这个镜检我们在这个显微镜下看到了有胎儿三毛滴虫，然后就说哎这个是，但是呢就是说我们没有看到，不代表就说这个猫咪的粪便里面不存在滴虫。因为就是说这个镜检它不是一个非常敏感性不是很高的一个测试，它有很高的这样的几率会出现这个假阴性。所以呢就是说在做检测的时候老师会考虑做这个 PCR聚合酶链式反应来进行排除真的是没有这样的一个情况。即使说镜检了发现真的是阴性，老师也会再做一次 PCR 来确认真的是没有滴虫的感染。
And to the second part of the case, I would definitely be doing all the adjunctive things that might be helpful for a cat with chronic colitis. So adding fiber, either in the form of a prescription diet or adding psyllium to the diet.
然后就是针对这个猫咪的另外的一些处理的话，我们当然也会考虑用一些其他的一些方法来增加它的这个粪便的一些纤维量比如说这个含有纤维的这些处方粮，或者呢是说是在这个饮食的当中来增加这些车前草这一类的这种物质。
And I don't think there's any harm in trying probiotics. However, there is very little evidence for their helpfulness. It is suggested if you try them to use them for 6 to 8 weeks.
然后还有一个的话，就是说我们真的是我们也可以就是考虑来使用益生菌。虽然说就是说这个益生菌的使用效果，这个效果怎么样？这个证据是不是那么完备，但是呢就是的确也是可以尝试的。那可以就是使用6到8周的时间来增加这个粪便来增加这个饮食当中的益生菌的含量。
And yeah, failing that, we do know that untreated cats, usually their diarrhea does resolve after about 2 years. So it's possible that if it is T. fetus, that the cat's about to finish running the course of it as well, even though it's been resistant to ranitidine.
然后就是说绝大多数的这个猫咪的话，它差不多2年内会有这个腹泻的这样的一个情况会得到解决，但是它仍然会携带这个 胎儿三毛滴虫。
Are there any questions about that case? I hope I've helped whoever it was that asked it.
然后就是刚才的这个这样的类似的病例的话，也可以就是说继续的来使用罗肖唑。那就是关于这样的一个病例，大家有没有什么问题或者是补充或者是有相关的一些讨论？
Great. Okay, so there were two other questions. One was related to corneal sequestrums, and the other was related to IMHA in cats and dogs. I don't mind which one, if there's a preference for me to talk about one.
好，然后我们还剩一点点时间，然后我们这个提供给老师的问题的话，还有就是，我们可以选择一下，一个呢是关于这个犬猫的这个免疫介导性溶血，它的这样的一个异同点，然后它的这个管理，或者呢是还有一个是关于这个角膜腹股猫的角膜腹股的这样的一个治疗方案的考虑。那大家就是有没有什么建议或者提醒，或者是想要了解的，那现在可以回复一下。
And if there's no questions, I'll just do the sequestrum one. I think we can squeak that one
in. How are we going, Annie? Do we think you want to keep going? We've got one. We run through sequestrums. We're at an hour and a half, aren't we? We're almost 2 hours. Oh no, hour and a half. Now keep going.
Yeah.
Yeah.
Keep going.
Yes.
Okay. The sequestrum.
We got a few people typing number 1 in the chat box. So I think maybe you want to hear about the IMHA between dogs and cats. Yeah.
That's fine by me.
Yeah.
So when I was given this question, I made a point of I let Beck know actually that comparing cats and dogs is hard for me now because I don't see any dogs.
那就是老师最开始拿到这个问题的话，然后他会觉得，哎，其实对比犬猫的异同点对他来说是会有一些困难，因为他现在不看狗了，主要是在看猫，基本上都不看，就没有狗的病例。
So I'll have to just remember what I know about dogs and why they're different. But first of all, the similarities. IMHA in both species is the immune dysregulation and the immune system dysregulation leading to destruction of red blood cells.
那老师会尽可能的从他这个记得的这样的一个内容里面来回答犬的问题，然后但是就是不管犬还是猫，它的这个免疫介导性溶血，它都是免疫系统的失调导致它红细胞受到破坏。
And there's two types of IMHA. There's primary, which is also idiopathic, and there's secondary, which can occur secondary to many diseases, toxins, cancer, infection, etc.
那就是这个免疫介导性溶血的话，其实是有3大类，主要的要不然就是这个原发性的或者说这个自发性、特异性的这样的一个免疫介导性溶血，或者是这个继发性的溶血。那这个继发性的话，有可能会有各种不同的这些疾病，有些时候是中毒肿瘤感染等等。
So one of the main differences between cats and dogs is that cats very rarely get primary IMHA. Most of their IMHA is secondary, which is different from dogs, who I think mainly get primary IMHA.
那这个犬猫的一大不同地方就是说，在这个免疫介导性溶血里面，猫很少会这个是有原发性的，但是呢，狗的话可能就是会大多数的是这个原发性的比较多，那猫的话是非常少的。
The other thing that happens in cats is you don't get spherocytes on the blood film, and so it's harder to diagnose without things like a saline agglutination test.
那还有一个就是一个区别的话，就是说在猫我们在测试这个它的这个血液图片在看的时候，很少会看到这个球状细胞，但是狗的话是可以看到的，所以就是可能是需要用一些其他的一些方式，那比如说这个盐水的这种加生理盐水，然后再加一些其他的这个凝血溶血的这样的一个测试，可能才能进行诊断。
The other difference is that dogs usually get a really regenerative immune-mediated hemolytic anemia, whereas cats is often non-regenerative, so which can make it harder to diagnose. And that's partly because often in cats the immune system is attacking the bone marrow red blood cell precursors.
然后就是还有一个区别的话，就是说狗的话，它绝大多数的这样的一个贫血，它是这种再生性的贫血，但是这个猫的话，它的这样的贫血大多数是这种非可再生性的贫血，然后就是主要的原因是因为它的猫咪的这个免疫系统，等它在它出现免疫介导性溶血的时候，它的免疫系统是会去攻击它在骨髓当中的这些红细胞的前体。
So the mainstay for treatment in dogs is immunosuppressants. The mainstay for treatment in cats is work out what's causing the IMHA.
那就是对于治疗来说，对于狗，它绝大多数是用这个免疫的这个抑制剂来进行这个免疫的调节。但是对于猫的话，其实它的这个治疗是说要找出它的潜在的病因，它不能说是就是这样对症的去治疗。
Once I've worked out what is causing the IMHA and I'm addressing that, if the hemolysis is still severe, I may then consider immunosuppressants.
那就是说，在老师排查了所有其他的一些原因，到底是什么导致它的这个溶血发生，然后呢，他才会去考虑如果说这些都排查了，然后它仍然会出现这个免疫介导性溶血的话，这个时候老师才会去考虑用这个免疫抑制剂。
And in dogs, there's heaps of evidence for lots of medications, immunosuppressants, but also blood thinning products for IMHA. And in cats, there's no evidence for anything, and so it's all empirical.
那对于狗的话，它就是有一些这个发表的一些研究，有这样的一些证据说这个免疫介导性的这个免疫抑制剂是有效，而且它除了免疫抑制剂以外，它还可以使用这个血液稀释的一些药物。但是对于猫的话，没有这方面的研究，所以就是说它在用免疫抑制剂的治疗的话，其实大多数是基于一个经验性的一个使用。
And in dogs, as well as your corticosteroids, some people use azathioprine more and more, but this is completely contraindicated in cats.
好，那就是说，除了这个免疫的抑制剂，很多的人可能会用这个泼尼松龙这一类的药物，然后就是但是的也有的人会用这个硫唑嘌呤，但是的话，在猫里面是不可以用硫唑嘌呤的。
And with primary IMHA, if you do have that, in cats, the prognosis is actually a bit better than dogs. They're not sure why that is, but it seems to be that dogs are more prone to clotting problems such as thrombi, and DIC.
那至于预后的话，这个原发性的免疫介导性溶血，它这个猫咪的预后要稍微比狗的要好一些，因为就是大家也并不知道这个后面的原因到底具体是什么，但是就是说这个狗的这个因为免疫介导性溶血产生的很多的一些并发症会更高，有一些风险和几率比如说这个血栓的这些问题出现这个血栓的这种栓塞，或者是这个弥散的这个弥散的DIC 弥散性的淋血。
That's it. Are there any questions?
弥散性的血管内淋血，那大家有没有什么这个问题针对于这个针对于我们刚才讨论的这个内容？
Okay.
Wicked. Well done, man. That was a lot of information.
Yeah.
Thank you so much. That's fantastic.
You're welcome.
And I can see we had lots of people join, which is fantastic. Annie, would you like to ask everybody if there were any questions that didn't come up along the way, if there's anything they wanted to ask about the subjects that we covered?
那就是非常感谢大家能够参与，然后我们也很多的人在线上。那就是大家有没有什么更多的一些问题之前想要问的没有问到，或者说我们刚才讨论这些讨论的这些问题里面还有想要继续讨论的内容。
Nothing?
No. Yeah, I think we're good.
Right. Awesome. Okay, then I think that all that remains is to say thank you again. That was so good. I learned so much. I realized I know nothing about feline medicine anymore.
Yeah, it's a tricky area. There's no evidence for anything. We're all just winging it.
No. Yeah. Yeah.
Yeah.
I understand. Cool. So thank you so much, everybody, for attending. For you. Thank you so much for speaking and preparing, and thank you so much for all our trainers for attending. I know that